This video will demonstrate flexibility and mobility at the elbow, wrist and hand. We'll begin this video by demonstrating the wrist. The wrist consists of 4 movements, which include wrist flexion, wrist extension, ulnar deviation and radius deviation. In order to assess this, I'll begin by assessing active movements. Active movements refer to movements that an individual can perform independently using their own muscles and don't require any assistance. This is done in order to review range of motion at the wrist. This video demonstrates flexion at the wrist, which is an active movement, followed by an active extension. The next video demonstrates radial deviation, followed by ulnar deviation in active. While doing these movements, I've decided to put the client in a seated position. This is done to isolate the wrist and stop the arm moving too much. This next part demonstrates passive movements, which is the movement of a person's body part that are executed by an external force. Passive movements are used to assess flexibility and mobility and to detect any restrictions or abnormalities. When performing passive movements, I will be feeling for the end feel of each joint in order to see if it feels normal and also assess the client's reaction to identify if there's any pain or discomfort. I begin by assessing wrist flexion, followed by wrist extension, then ulnar deviation, followed by radial deviation. This final part of the wrist demonstrates resisted movements. When doing the wrist, it has been advised to only do resisted movements. This is due to there not being as much range of motion as other body parts. Resisted movements involve the application of resistance against the patient's muscles. The resistance comes from the therapist applying pressure in the opposite direction. This is done to test for any imbalances or pain. It will also determine if there's any weaknesses to identify what the problem is. It can also be used to see progression over time in order to see improvements. I begin by applying an isotonic pressure against the flexion movement at the wrist. I then move on to resisted extension movements. Then I apply pressure against the ulnar deviation, followed by radial deviation. Next, I move on to the elbow. The elbow consists of 4 movements also, which are flexion, extension, pronation and supination. I begin the video by assessing activation with a flexion movement, which I instruct by telling the patient to bring their hands to the shoulder. I then assess extension, which is straightening the arm. After this, I bring the client into a mid-range and instruct them to point their palm of their hands to the floor. This is an example of pronation. I then tell the client to point the palms of their hands up, which is supination. Next, I begin passive movements at the elbow. I begin by taking the arm into a flexion position, then I push the arm into a straight position after, in order to assess extension. After this, then, I take the arm into a mid-range and turn the hand into pronation, then followed by supination. Then, finally at the elbow, I begin resisted movements. These movements begin with an isotonic movement while flexing the elbow. I then follow this by doing an isometric hold at the extension of the elbow. After that then, I begin assessing supination and pronation by doing an isotonic movement, which is going through the entire range of the movement, and then follow this with an isometric hold on each movement. Then finally, I would place the client on the bed in order to assess the elbow by performing an isotonic resisted movement at the elbow. This movement is extension. When doing the pronation and supination, I ensure to pin the elbow at the body. I do this to ensure that the only joint that's moving is the elbow joint. When doing the movement of the extension of the elbow, I ensure to pin the shoulder on the bed. I do this to ensure it doesn't lift off. And finally, I will end by assessing the hand. I begin by actively assessing thumb flexion, followed by extension. After this, opposition is performed. There are another 2 movements at the thumb, which are abduction, which is bringing the thumb away from the hand, and adduction, which is bringing the thumb to the hand. I then assess flexion at the phalanges by performing a passive movement. I then do the same in order to assess extension. Next, I passively go through the range of motion at the thumb, which begins with thumb extension, followed by flexion. I then move on to abduction, followed by adduction. And finally, I resist each movement, only doing isotonic movements. I begin by assessing each individual phalanx in flexion, followed by assessing resisted extension at the thumb, then at the thumb also flexion. I then assess thumb adduction, followed by abduction. In this next part of the video, you will see me perform resisted isotonic movements at the phalanges while doing an extension movement. For the functional test of the elbow, wrist and hand, I decided to do the press-up. I decided this because it incorporates each movement to make it easier to assess. When the client performs the press-up, I made sure to review the movement of the elbow and ask, does the wrist joint under load feel any pain? I also asked the client after if they felt any pain and where, in order to gain an understanding of the injuries they might have.